Okay, so again, everybody, hello. On behalf of the European Gymnastics of the Technical Committee, I would like to congratulate you to participate in this webinar. We will do some more webinars from this kind of style. Sometimes it will be physically, sometimes mentally. This time we are with Adam Badir, one of the best physiotherapists around the world, who really treated the best gymnasts all over. So Adam, the floor is yours. Good luck.
Okay. So hello, everybody. I'm happy to be with you here. Actually, I started with gymnastics before 13 years. So it's an amazing journey, especially the last Olympic Games. So let's say from Beijing, I'm joining and understanding more and more about this amazing sport. And I'm happy to be with these teams, with these people all over the world in all the competitions. So hi, everybody, and thank you for participating in this lecture. A lot of questions that a lot of physios in competition ask us, how we deal with our team, how we manage, how we do what we call the magic in physiotherapy. So I wanted to give you a little bit touch about the special aspects of accompanying the elite athletes, especially gymnastics, because gymnastics is different from any other sport. From one way, we are dealing with power sport. From the other one, we are dealing with long competition. We are speaking about 3 hours of competition for the all-arounders. We are speaking about participating in different elements, different needs of the body. So we will share a little bit of ideas, and I will show you a little bit of the things that we do with our gymnasts. But first of all, we will speak about the principles and the basic things that guide us working with these guys. So I hope you will enjoy it. Okay, so let's start.
Adam, 1 second. I would like also to say hello to everybody on behalf of Mario Vukoya, our president of technical committee at the European Gymnastics. Unfortunately, he cannot join us to this Zoom meeting, but he's sending regards to everyone. So excuse me, Adam, for 1 second, and thank you again, and good luck.
Okay. So we say hi to Mario also. So hi to Mario from Israel. So when I thought about building this lecture, actually, I wanted you to have some touch of the procedure, especially in the competition period, because we are now in the Olympic year. We have in March 3 World Cups that will decide who will participate after that, after all the list that was in. And I wanted to ask you some questions, few things that we don't pay attention to, because we don't have all the statistics that we need. We don't have medical records of all the gymnasts all over the world. This is something that is missing. We need the research. We need based evidence work so we can do our things right. So the first question, the answer can be, can be positive, can be negative. It depends on the teams, depends on the countries. But are there more injuries in competitions? This is a big question because we don't have records from all the competitions. We have World Cups, we have local, what we say, local events. And we have the big events, European Championship, World Championship, Asian Championship, and the Olympic Games. So all the records of the injuries and the kind of the injuries, we don't have connection to these things. What are the factors of predict injury during the competition, if there's any? Can we predict injury? And this is few questions that we will try to answer today, by the way. So can I predict that my gymnast will have back problems, will have knee problems, foot problems? Depends on the history depends on what I see, depends maybe on tests that we will make. In football teams, because of the soccer teams, because of the money that they invest there, they have very, very positive system. The beginning of the season, middle of the season, end of season, we have statistics, we have tests for the players, and we have also the records, the medical records. But do we have it in gymnastics? Why we don't do it? So how do you determine the intensity of the pain in due emotional stress or reflect of real situation? We know that gymnastics is also a needs a lot of mental thinking and a lot of mental work with the gymnasts. The question is, when we get to competition, is the pain increasing? Is the pain getting more powerful? And if this pain is more powerful, is it real pain or is it a stress pain? Is the tendency of injuries close to competition related only to physical load? Is it the coach fault, the gymnast fault, maybe waking up late, maybe the programs are mistaken, they work with the same gymnasts? When we have team, do we need to work the same system in power? All the training, all the reflect of the treatments after, how we do it? And the last, how can we keep our athletes safe during the period of competitive continuity, and especially in money time from injuries and pain? If we get to competition, we have the last 2 minutes, of competition on the element, on the apparatus, and how we do it, how we bring him there with the best conditioning. So these questions always was the headlights of the questions that I provide myself when I work with athletes. So let's first dealing with the success and failure 2 elements. We have the psychological element, which is taking big part of our work, especially physical therapists, especially in poor teams, what I call teams that don't have all the medical team, all the medical stuff that cover them. And we have the physical elements. The physical elements, it's more controllable, things that we can see, measure, and check always. So when we have to start these tests, and I built some screen for the things that we can affect and not affect on. So we have the psychological element, which is connected by all the research to the physical effect. And we have the chronic pain, which is the chronic injuries that we know about the medical history of our gymnasts. And we have the acute pain, which appears close to the competition period. The other things that we wrote about the group coping and the professional intervention, these are things that we can control by having the mental coach, what we call. So we work with the team on having a strong group, having a strong team, but we always remember that gymnastics is individual. It's the gymnast and his apparatus, not more. So he needs to deal with a lot of psychological elements that can affect also the physical effect. And what we will deal with more today is the acute situation, the things that appears during competition period. So we need to be more smart and more previewing all the picture of the gymnast. Okay, so we have the components of fitness. We have the cardiovascular fitness. We have the respiratory fitness, flexibility, power, and controlling the loads of the competition. 5 components of health of the competition participator. These elements are agreed by research that can build a good situation for the athlete to come to competition. And it's not only for gymnastics. It can be in all the individual sport participating factors. So what makes them better than the others? Why these gymnasts come to competition, participating, standing in the mental load, the physical load, sometimes with injury, but succeeding, making the best of the best competitions. So let's take the possible causes of injury close to the competition period. If we are speaking about the first element, we have the trauma. Trauma during the element of participating, during practicing, during the power things. We have the overuse injuries and we have the overload injuries, especially in the period that we build the exercises for the gymnast. We build the exercises and we raise the hardness and the quality of the exercise. So overload and overuse things are things that we can control from the beginning, and I will speak how after. The trauma is something that's happening and we have to deal with. And when we deal with, we have to be thankful more than the square that we think in. I'm speaking about participate or not participating, because when we have trauma or when we have injury in gymnastics, the first question, can he be ready for training for the competition, not competing? Let's say in football field, we don't need always this period of practicing, of working up, building the exercise, doing the exercise during the practicing period, than the competition period. Sometimes you have a player, you make him ready, and when he's ready, you go on, you take him to the field. In gymnastics, it's impossible, because the deadlines that we build in rehabilitation programs, especially in trauma, is the deadline, the red line that we participate, the practicing for the competitions. So these things are very important and very, let's say, unagreeable between the doctors, physical therapists, massageists, and all the team that working with the gymnast around him, especially the coach also. So if we are speaking about the elements that we can see that can affect these three things, we are speaking about the technique of the gymnast and the loading of the gymnast. These two things can be controlled by the coach, but the physical therapist is playing major and big element in doing these things with the coach. If he's not, and he's out of this team, there will be a problem in deciding. The physical impairment and the balance between the muscle groups are these things that we work on all the period. We have these things all the period of the season, from the beginning of the training camp to the other things that we have to do during the year with the gymnasts. And these programs we need to build. We need to think how to do it right. So supplementary training. Supplementary training is a very huge, let's say, very huge element that we use in building the programs for these gymnasts and these athletes. I'm not speaking about gymnastics only, but it can be also in all the other programs that we build for athletes from the beginning of the season, searching the reasons for injury, finding the reasons, and building the balance between the muscle groups, the effectivity of the functional training, the supplementary training, and how to get it also inside the program of the working time of the gymnast, because 2 training a day, 6 hours of work, 5 days a week. When you have 1 day more for rest and 1 day for one practice, easy practice maybe, So where do I put these things? How do I work with my gymnast? Which coach will give me this time also? What factors affect the risk of injury? Training load, we spoke about training load. So if I see that a gymnast having more injuries than others, then there is a leg of the training load. I have to think if it's training load or the bodybuilding of this gymnast. The fitness, what he do more, what he do out of practice. We have to get into his programs. Let's say if he's doing gym and he's doing full weight or body training or CrossFit training, we have to get into this training because sometimes the lack is not only building the program, is doing balance inside the program. A lot of gymnasts doing power training, load lifting. So these things, are they affecting to the right side or not the right side? Because we have a lot of programs all over the world. When we see in competitions, we see some guys work in powerlifting, some guys love the full weight training, some guys do fitness, sometimes some gymnasts take care of the fitness, of their fitness. So what is really affecting? And injury, old injuries, how they affect? Can they wake up during this training period? Are they going to affect the program that we are building? Or it's just something that passed and it's not exist anymore? Performance, the power of performance, affecting all these measurements, because performance, the way that the gymnast or the athlete make the performance is affecting during all the lines and connecting all these lines together. So which one affects which one? This is actually slides that show the effectivity of being physiotherapists in the team, but full-time physiotherapists, not only treating the programs, getting involved in building the programs before the injury, inside the work, and we will speak about it also inside. So how we keep them safe, how we keep our gymnasts safe, our athletes, how we keep them safe. So if we are having here, in this photo, we are having 3 gymnasts. One is an Olympic champion. It was after the Rio Olympic Games, actually, that he visited our clinic. And we have 2 young guys from our team that was injured. If we are thinking who is more in pain or who is more in injury, I think that you can understand how the effect of the quality of performance, quality of work, quality of the elements that the gymnast do affect his success or not success, and affects in the last minute his injury, especially before competitions, because during the period before the competitions, the load is so much and the mental stress is so much. So thinking inside the exercise, let's say, can affect and can cause acute injury that can affect the competition. We can lose a gymnast, especially in the team competition, when we have no much gymnasts like the Israeli team, let's say, which built on 8, 9 main gymnastics. How we can affect and take care of that these injuries that we see. Oleg here was here because overuse, overload injuries, but these guys are in traumatic injury. Traumatic injury can stop competition, can stop training, can stop preparing to competition. So, how we do it? Where to start? This is the big question. If we are in the beginning of the season of competitions, and I take the period of 3-4 months before the competition, because preparing to competition, I need 2 months clearly training period. I need 2 months preparing to these 2 months. So I'll take a 4 months period preparing to the period of competitions. which tests we have available all over the countries that we can make. So stress test can be made by a physician, can be made in lab. We can see that the power and the health of the gymnast is on the right line. By the way, in football and basketball teams, they make these tests in the beginning of season, middle of season, end of season. So we in Olympic teams, we have full system that make these tests, but in the clubs, let's say, in the young gymnasts, we don't have these tests, and these tests can affect actually the career of our gymnasts. The maximum oxygen consumption tests can give us idea about the cardiovascular problems that we have or we have to deal with. Especially, we make it in lab, and we make it in the beginning of season. With gymnasts, we make it in Israel. In the Olympic team, we make it also before an intensive period. So we can have these tests and compare from period to period. And we have the orthopedic review. Orthopedic reviews is a big subject that needs a separated lecture, because there's a lot of orthopedic reviews. The famous one in gymnastics is the Stanford orthopedic review that we make to gymnasts. It's a test of 1.5 hours. You go by the test, paper by paper, you ask your gymnast to do things, and after that you get like a final score. And by this final score, you can know in which condition your gymnast is. Analyzing these tests, especially the Stanford test, can give us also an idea about the situation of our gymnast and the weakness of parts of his body, and where we can find elements that we need to work on or to prevent the injury there, because we know that these injuries will be in this condition. Injury prevention tests and fitness assessment. Targeted fitness tests, we spoke about it. We have a lot of tests. We don't need it too much in gymnastics because we need more the physical tests. So we will go to the isokinetic tests. Isokinetic tests today, we have a lot of machines of different companies. The most famous one is Biodex. These machines can measure the power of the knee. It can give us picture about the working groups of muscles, eccentric, concentric muscles, passive, active. And by the score that we get in these tests, we can know in which situation, let's say, if I take, let's say, the ACL tear in gymnastics, okay? Isokinetic tests for the gymnasts can prevent and give us a picture about the situation that this injury can happen, okay? So it's very important not only to make it after surgeries, actually to make it before strong competitions. We can make it 4 months, 5 months before, and we can get results that can give us idea about the leg situation, the groups of muscles, if we need to change things in the intensive loading program, we can take off a little bit work of legs. We need to work more on groups of muscles. These things are very important to prevent the injury. And I'm taking a little bit something that you don't know, that you didn't meet before, state-of-art computing tests that we have today, like Physimax, let's say. It's a kind of test that you ask the gymnast or the athlete to make some movements by the program of test. It's specially to each kind of sport. And it compares between the right side and the left side. Actually, we get some scores that give us idea about the weakness of the left side comparing to the right side. And it gives also an ideas about training programs that we need to give our gymnast or our athlete. So these tests can give us an idea about the situation of our athlete and our gymnast. And it's very, very important not to make it after the injuries, actually to take it before the injuries, 4 months to 5 months before the participating competitions period, especially in the very important competitions like Europe champion, world champion, Olympic Games. Okay, so how we prevent injury, where to start in building the program. As a physio or coach that building the program, the bar program for the training outside the gym or inside the gym, even before the training, before the practical training, we need to see this pyramid as the highlight guide for building these programs. So load management. Load management needs to be individual, not the group, not the work time. We need to go to each program of each gymnast. We need to see the load management inside also the athlete practicing inside the gym. So we check how much balance he makes, how much power he makes, how much training on floor. If he make the elements 5 times, 6 times, 7 times, maybe this is the cause, can be the cause of injury. If I know that there is weakness in the knees or the feet. Strength training. Strength training can be before or after or dependent training. From my experience, we gave strength training, building program for each gymnast is the best way. So he has his own time, the day that he makes one training a day, and the other part of the day he makes the strength training, especially maybe day after rest day, before rest day, or after the rest day, so he can get his activity and get the maximum benefit from this training. Movement skills. Movement skills is something that we can control, something that we can build. I see where the weakness of the movement skills, speaking with the coach, participating with him in trainings, seeing my gymnast in work, and see where can I find. Let's say if I have a problem with one gymnast in landing, okay, from exercising, having a full feet touch, and I see that he always goes to the right side. What should I do? How should I take him to the left side? How should I take him to the 2 feet on the floor and not 1 feet? If he makes a lot of steps because feeling uncomfortable or having a lack of deep feeling of the movement. So these things are things that we can build, we can do it, and we can build it for our gymnasts. Flexibility. I think it's one of the most biggest reasons in gymnastics for injuries. A lot of gymnasts has lack of flexibility in parts of the body, not all the body. So flexibility should be worked on passively, actively, building program flexibility and doing the things that we need. Sometimes we need the tapes and the braces, not only for dealing with injury. We use tapes to unload areas, to release the pain, to release the power, to release also, move a little bit the muscle so other muscles, other groups of muscles can work. And we use tapes in the beginning of competition or the beginning of training. And who saw me a lot of times with Artyom, let's say, I tape his back and I tape his shoulder, not because he's injured, actually because in order to give him some support or some holding feeling that he need to take care and work right. Walkerly and other things depends on the needs and on the systems that you have in the gym and in your work. So if I take, let's say, period before the competition, about 3 months to 4 months work. What in my program that I built my gymnast, very important, what he needs: upper limb, down limb. Here I'm showing some simple exercise, making the unbalanced power in the upper limb, not in the down limb. The down limb is activating and working, but we have a water ball that connected to the gymnast, and it gives his work actually different review, actually in making very simple activity, landing and jumping. Okay, so the water in the blue one, in the blue balloon, is moving the body, the upper limb. And I'm giving these instructions by seeing the movement and proving the movement in order to have the balance and controlling the upper limb, not taking to the left or to the right side, actually landing in the point that I want to do. So, which things that I can give group or team work in order to prevent injuries? One of the training that we use with our gymnasts is Pilates. There's an idea about Pilates that it's for ladies sometimes. The Pilates can work on core only. But here we are bringing another view in the Pilates. Why we do Pilates? Because it's unloading areas in the body. And I control 3 elements actually on Pilates bed. I can control flexibility, quality of movement, and I can do also power training. That's very important. You can see our gymnast team working on targeting, working with the legs during control of the core in order to make the right work during the training. We are speaking about 1 hour a week. We do it in the period of intensively work, so we can give them another element. And if you can see how much it's hard for the gymnasts to participate in these things. We take them out of their zone, out of their comfort zone, out of the power zone in movement and exact work, balancing the core during legs work. Okay. If I'm building a program for my gymnast, I take the elements after the examination, the physical examination, and I want to have some ideas. So these simple things can be in the gym actually, can be in gymnastic halls, and you can give it to the gymnast practicing before or after the training, and taking him out of his zone, giving some elements of instability, or even with the taping, as you see on the chair, we have this taping line, so we can make the positioning of the movement that I want and the exact landing point. But let's see it again, because it's very important. You can see a full exercise training of working on balance, on pointly, and on work. If I want to make this exercise, let's say, harder, I can jump through the chair and landing on the knees, or working with one leg, directioning the landing point. If I have gymnast with strong twitching, fast movement, he needs to control the movement exactly in certain points of the work of the legs, I give other exercises. I build exercises for him. I'm taking the Pilates bed because it's something out of conscious, out of our knowledge. So we are using it a lot in clinic, and we are having, as you see, we are having the big hall of gymnastics, of Pilates inside the clinic, actually. So here we see core work, controlling the point of the touch, working on the 2 feet touching, first and right, right, left, left, right, giving the points of touch, full movement of flexibility, working with the fastness and how much fast I need this element to be. This is prevention, by the way. This is not treating the injury. When I treat the injury, we make the exercise a little bit more simple, more without the fast movement, and we give the instructions differently. So as we see, Andre here is making one right, left, left, right movement, controlling the speed, controlling the time of touching the jump board. If I need some training of poor areas, let's say we know with this gymnast that he has some injuries sometimes in the pelvic area. Before each competition, he has some problems that we need to deal with. We decided to build an exercise that can take the core and the power exercising to different method. We are controlling the legs, controlling the fast movement, but we are working on the core again and again and again. Working with the team is a different issue. If I'm taking the team and I want to take different points inside the team of flexibility, I can do it together in group training in order to get the time right. Okay? So this is working on flexibility. You see that some gymnasts have more problems than the others. Some have it easy, some have it differently. So the bed can give me some equipment to change the power that I work with the gymnasts. See it again? You see that some of the gymnasts are taking hard and getting harder. Sometimes we get a little bit of the information also about the muscle groups working, weakness in different from these trainings. So these trainings always being in contact between the coach that make the training and give us the ideas about the specific work with these gymnasts. Team training, the difference between the gymnasts, the bodies, we can see in this training. See that some of the gymnasts can control the movement without touching the floor powerfully, and others can't control the movement all over the range of motion. Let's say if I take a jump horse, or if I take the floor, if I take a lot of elements, needs movement all over the range of motion. And we have a lot of problems controlling the movement in the inner range, outer range, and the mid range. So these things need to be worked on, because I'm working on these things actually give the gymnast weakness point inside doing the exercise, inside doing the element. So we see the difference of controlling between the gymnasts. You see the difference between Artyom, let's say in the middle, controlling the movement all over the movement, and between the two gymnasts, besides having a lot of problem controlling the core, controlling the back, and controlling the movement of the legs, of the power of the movement. Let's say if we see here in the beginning, you can see that in the outer range, it's very hard to control the movement. So he tried to make combination between other movements in order to succeed. He's bending the knees, and this is giving us picture of the gymnast making this in the exercises spontaneous or automatically, because he need to think. If he will think inside the exercise, everything will fuck up. But here, these things are giving us a different picture of controlling the movement. So if we need speed work, okay, if we are speaking about speed work, we can also use a lot of exercises, numbering, taking the numbers of movements, fast movements, exact movements, during control of the core, working of the legs, and having different issues from last injuries. Let's say the gymnast here in the video has an ACL tear in the right leg, injured before 10 years. And now we are controlling the movement actually, and we are taking the weakness points and turning to PowerPoints. Okay, so if we had injury already, this is the biggest question. How do I decide that my gymnast can participate in competition? How can I decide that my gymnast is working and can work in the deadline that I make with the coach and make the red line that I want him to train for the competition? What do I do in this period? Okay. The first question always, I'm going to orthopedic doctor with an injury with a gymnast, asking if he can participate. But this is a wrong method of thinking, because 99.9999 of the doctors, orthopedic doctors, don't understand in gymnastics. They don't understand gymnasts. There is very, very unique quality doctors that participated in gymnastics, knows gymnastics, understanding gymnastics. ACL tear, okay, can or can't be worked with. This is a big question we had before 3 months, 4 months in European Championship. 1 month before the European Champion, the big injury of Artyom in Qatar, everybody knows about it. Turning the knee, landing on straight knee, and we had the injury. We thought that the European Champion is over and he can't participate in European Champion. After seeing the MRI 2 days after the injury, actually, my decision was that he will participate. You know, the answer of his doctor that made his examination, he said, "You're crazy. I don't think he will succeed." I said, "We will build the program, we will go on with the program, and we will see how we deal with it." Okay? Why I decided that he can participate? Actually, we made 4 weeks program until participating European Champion. And this European Champion wasn't only important for Artyom, for the gymnast. It was important for the team. It was important for the coach. It was important for what will come in the World Champion. So we needed to decide if he can participate or he is not. So if I have injury, where do I have to check? How do I have to think? How do I have to decide? This is a big question that goes with me each time that we have injury, that we have decisions that we have to take, not only in gymnastics, by the way, because we treat also here judo guys, we treat athletes. And the way of thinking, the way of rehabilitation thinking, knowing the kind of sport, the powerful and the ability of your gymnast is giving another view of thinking. So poor technique can affect actually the work. Doctor's checkup can affect the work, his decisions. So you have to need language with the doctors. Imaging the injury is very important. The question is which image? Do I go to X-ray and trust the ultrasound, or do I need the best and the powerful MRI testing in order to decide? And of course, what treatment program I built during this period. And the treatment period starts from the day of injury, from the minute of injury. What do I do after the injury exactly? Taping and fixation is a good method in order to take this. Let's say if it's a knee injury, I can limit the movement, I can limit the power that it gives. Medicines and ointments are very used to increase the activity of the gymnast. But we need to be careful here, because I need a true feeling of the gymnast that can give me an idea about what he feels, what his pain, what grade his pain is. And of course, the manual therapy, things that we can control in overload and in the work that we do with the gymnast. So if I take these things, I can actually make the programming, the work. So we'll skip this one. And we will have some discussion or some idea about our Olympic champion, Israeli Olympic champion, because he is the model in this lecture, actually. So what I wrote you is all the injuries all over the age until the period we prepared to Tokyo, because preparing to Tokyo, it was different issue. So if I take Artyom, these injuries are known and we have it also acceptable, and almost everybody knew about these injuries. So I will just review it. In age 13, he has a PCL tear, 4 months rehabilitation. That was the period. And if you see, it's very important to have a study case or a medical record of the gymnast, because when you go with him all the period, when you have this gymnast treating him all the period, you can understand how his body recovering also from these injuries. The grade 3 stress fracture in L5-S1 in age 16, 6 months of rehabilitation. It was a big program that we did, actually. The doctors that checked him decided that he can't participate anymore gymnastics and he need to quit. I was in head very, very balanced that he can compete and can complete also working. We built program from zero. He didn't participate in gymnastics, and actually we took him to other directions. And in that period, we worked very hardly to get him into shape. In age 17, 1 year after, he won the first medal in the world champion. Head injury caused of falling on head. The famous injury in Baku, falling on the head on triple. And actually what saved him, it's not what we did in that period, actually. What saved him is his flexibility. So when we speak about flexibility and taking care of flexibility in gymnasts, it can prevent also tough injury. And 2 months of rehabilitation, it was very, very fast, very fast. And what saved his life, actually, I can say here for 100% is his flexibility. ATFL ankle tear at age 18, after the world champion, before the European champion, before the first medal in the European champion, he had an injury and ankle tear of ATFL. Shoulder injury, SLAP stage 3, which going with us. By the way, the pain of the back, as you know, if we have here physios, stress fracture don't pass. We need always to be in control of it because it can appear very easily. So if I know the record of the gymnast and I see the record of the gymnast and I know that the back is going, can be a point of red line that I have to take care of. So the solution was very easy. Taping him before each competition and each training. We make a taping to take care of the back, just to be on the safe side. So don't think that injuries pass. Try to prevent the coming back of the injury or having the pain caused by the injury. Shoulder slap, by the way, we are dealing with it for more than 7 years. He has no pain in the shoulder, but we make the taping before each competition and each work on the rings and the elements that he need more shoulders for. So he take it in these elements. He make the taping and he take it off after the element. So he can be free from this feeling also in the next apparatus. So the price is not easy. Our gymnasts, it's their dream, but it's also your dream. The coach, the physios, the team that work with them. This is actually our moments. And we experienced it, we dream about it, we want it. So it needs to be a close teamwork, working between the coach and the medical team intensively. I'm speaking about 5 days a week that we deal with these things, talking with the coach, dealing with each gymnast about his injuries, about his pain, and about prevention these pains, taking care that he makes the training that we need him to make, making his program of preventing the injuries. And in acute injury, we take care that we make the tests fast, the MRI fast, building program from the first day of the injury. Actually, he don't go and rest at home. The hardest injury that we saw in the last few months, last weeks actually, before the world champion, was 2 elbow dislocating inside competition. But this gymnast, after the surgery, 1 week after the surgery, he's in gym working on fitness, working on legs power, working on core, with the gips on his hands. So this is very, very important to us. The personal sacrifice that we do is very big, and we need to keep doing the work all over the way. So if we taking the last injury of the knee, if we are taking the last injury of Artyom in his knee, because this was a highlight, this was different, much different from all the injuries before. We had like 4 weeks preparing him for the European Championship. I'm speaking about partial tear of ACL, the ligament inside the knee, bone bruise of the lateral condyle, of his lateral condyle, tear in the popliteal fossa, back the pain, back the knee, in the hamstring area, and a very, very injury in the lateral meniscus of the knee. It was in Qatar, one and a half and a week, 5 weeks before the European Championship. I got the results, actually. I wasn't with him in the competition in Qatar, and we got the results from there, from the MRI that I asked to make in the first 2 hours. Why we need to make the MRI in the first 2 hours in competition especially? It was because we needed, before the knee swelling, we needed to have a picture, and we needed to know what kind of injury and how big was the injury. After landing in Israel 24 hours after, we made another MRI here in order to be sure about the tests and to have our picture 24 hours imaging his knee. After taking these things, I decided that we can participate in European Championship, and he can have full training 2 weeks before flying to European Championship. The question was if he can pass certain elements and work with what we have without giving him, also putting him in danger, because any mistake can cause full tear of the ACL, pain, tear of the meniscus, and other things. So the first 2 weeks was programming, keeping him in shape, first of all, using the Pilates beds, functional training, and special training, keeping each part of the body in fitness and in power to the coming war that will come after 2 weeks. Actually, we didn't stop since the first day to work with him. He was working like he was practicing. In gym, we did 2 things. All the elements of the apparatus that he could make without landing on the knees, we completed working on, because we needed, we were thinking about all-around competition. Second thing, landing on the knee in the beginning was with help. But we put a cast, a brace for the knee in order to keep the range of motion in angles that will not go to the pain areas, that will not be stress on the front condyle and the meniscus in that period. Second thing that we made and we took is making treatments, full treatments, in order to release the edema and the swelling of the knee, doing PRP injections, taking the blood, making the system, bringing back the plasma inside the knee in order to increase the period of the recovery. And working on the range of motion in this point without injuring the flexibility of the body, of the full body. Actually keeping the straight leg raising, same angle like the other knee, working on the range of motions, finding the points that he have the pain and trying to pass by them, completing, earning the range of motion. After 2 weeks of this work, we started in the gym on the acrobatic line to give him simple elements, taking him back to simple elements that he can do on the acrobatic line, landing on soft areas. Actually, not landing, full landing on the knees. In that period also, there was a big work on the mental side. Understanding that this injury can be treated and can be go on with it. And the third week, in the end of the third week, actually, Artyom succeeded to make half of the floor exercise and the elements that he don't need to be scared of. He don't need to think of. He can do it easily without getting in danger, without getting in the angles up to 90 degrees, let's say, that can increase the risk for another injury. Fourth week, we were working on the lines and landing from the other apparatus without working on the land of the elements that can be risky for him. In the end of the fourth week, we decided, me and Sergey, that Friday day will be the day that he can make full exercise with taking 2 lines from the floor exercise and doing them out of the exercise. Actually, these 2 lines we decided that he will not do until we get to the European Championship. And this was the risk that I took, thinking that he will be in head, actually, in the mental area. He will be ready to take the risk to do it without thinking. When we reached 3 days before the flying to the competition, he was like 80%, around 80% from the ability of the knee. I took the period that we have in order to get ready for the competition, taking the risk that he will have pain, talking with the doctors and speaking about the pain management, because pain management, it was, in my opinion, as a physio, is something that needs to be controlled, but not with medicines. Actually, we need to control it with physiotherapy using technologies. We have deep isolation. We are not speaking about only electricity, laser, or things like that. We have deep isolation. We have new technologies that can reduce edema and take the pain down and give us practice of 24 hours work. Actually, what you don't know, that each day in the competition in European Championship, I worked with him around 5 to 6 hours. We took another physio to treat all the team, and I was participating, working only with Artyom on his pain, range of motion, power, reducing from training to training inside the competition, having the fixations, taping, things that we tried before we get to the competition in order to have him in the safe side, not having injury, doing the tough and the hard things. 4 days before the qualification competition, we tried the full exercise and we have it. We have it, but we had pain after. So every day I had a talk with the orthopedic doctor that treating Artyom and his knee, reducing and thinking what to do exactly and what the risk that I'm taking by him participating in the competition. I didn't have a doubt that I'm risking him in that way that we can lose the participating of the coming competitions. But European champion was a way of thinking for Artyom also to prove his character, because I know him from last injuries, as you saw. Why I brought you this record of injuries? Because each one of injury for any other athlete, not only in gymnastics, can be the end of his career. And this guy, from my working with him, knowing the limits, trusting my work, trusting the word of the doctor work, and going with us all the way. And this is how we reached the silver medal in European Championship. Actually, it was one of the hardest, as Sergey said. And the words of Artyom after we finished the finals, it was, "You are crazy." I couldn't believe it. But he believed. Believe me that he believed. So if you have gymnast that thinks and he's enough powerful to do these things, take him to the limit. Don't stop. But with calculated risk, because calculated risk is the most safe way to give him his dreams. Gymnastic is calculated risk. Anyway, if you have quality, if you have good movement, if you have ability, if you have character, and if you have what this sport needs in mind, you can reach the highest top. When you're understanding this, you understand gymnastics. You are appreciating the work of the coach, you are appreciating the material of people that we are working with. And this is what's charming in this sport, because one thing I understood, I always say to my physios, we are treating acrobatic lines, we are treating a lot of gymnasts. What I'm saying always, that treating gymnasts is much different from treating any other kind of sport, because the material that we are working with is different. Thank you.
Adam, thank you so much for the wonderful lecture. I would like to tell everybody that from my point,
we are open for questions, by the way.
Yeah, soon we will open. But I would like to tell everybody that from my point of view, as a coach, as a judge, for many years, I don't think neither Alexander Shatilov, probably for sure Artyom Dolgopiat, could reach the level they got without the help and without the support and the professionality of Adam. He's really part of our success. And whenever you see Artyom is winning a medal or he's on floor or wherever he is, you always see the coach next to him and you always see Adam next to him, because this triangle is really the triangle to success. The support and the help of Adam is really also mentally, because he's a friend, he's a brother, he's part of the family. He's not only physiotherapist, he's not only professional in what he does, but also supporting with all other aspects. So now, if there are any questions, I can open the microphones for people who wants to ask questions. So just let me know if you would like to ask anything. I will be able to open microphones if you would like to. So anyways, Adam, I guess there are no questions because
by the way, the functional training that we make the gymnasts, if we are speaking about the program that we do, we work with our gymnasts in different ways. So we have one lesson of Pilates week weekly for the team. We have now a program built for 2 gymnasts that will participate in World Cups, that we think that it can improve their ability to do their exercises better. We are having, this is in Pilates, we have functional training, especially for weakness of parts of the body after testing some of the gymnasts that we need to participate in World Cups. And now we are building the program actually for Artyom for the Olympic Games, getting him ready to what going with him on his body. About the treatments, we make one weekly massage for each one privately, but we work with each gymnast like about 15 to 20 minutes each day, proving his flexibility. Let's say one gymnast has to release his muscles more because he has contracts. We do these things individually. Each one has his card, his program. We work with them in the gym. We work with them in the clinic. If you ask about the Olympic, the higher athletes, not only in gymnastics, they come to clinic between 2 to 3 times a week, not for treatment of injuries, for preventing injuries. So they make recovery. There's a lot of apparatus that we can use in the clinic, not only taking off the pain, but relieving and refreshing them for the next training next day. So these are the things that you need to take. You need to see. That you need to see. You need to think about. And one more thing that I have to say, we see a lot of young guys sometimes treating gymnastic, and 1 year, 2 years after, we see that they are changing, the physical therapists, the massagists. Gymnastic is kind of sport that you need to understand. If you understand gymnastic, you can treat your patient much better in gymnastics. So the most important idea, if you work with gymnastic as a physio or you are a coach, take one guy, teach him gymnastics, because understanding in the movement and how much power you need in each element gives the method and gives the ideas of working with the gymnast out of the gym. So participating with gymnastics more than 13 years gave me a lot of views and a lot of ways to treat things, and to know that this gymnast after this treatment will be there. And I can see where he will be in 2 weeks, 3 weeks, 1 month, knowing his ability, knowing his power, and knowing others without even examining them or working with them. So it's very important.
Thank you very much, Adam. Thank you, everyone, for participating in this webinar. It was really wonderful, a lot of knowledge, and hope to see you also at the next one. One second, there is one question before we leave, Adam. Can you be more precise on the instabilities work?
On the instabilities work, we use different methods. One of the instability problems in gymnastics, working with full weight training. What I did here is not taking this to full weight with bearing actually getting the upper limb and the down limb in two directions. So I can make the instability with water balloons that we make on the shoulders in order to give the knees more instability and more power that they bring from the upper side, because we always, all the thinking in treating or exercising is going to the lower limb, and it's working from the feet up. What I decided in instability, in order to have more sticks in standing, let's say, is taking the instability from the upper body. So it needs a lot of work of the feet and the feeling of the movement more than using the power. So the feeling of the movement and the deep feeling of landing is very important. So we use a lot of, even in let's say, if I treat ankle problem, and I ask the gymnast standing on 1 foot, I take him with a band, even if I take a red band or, TheraBand, and asking him to pull in different side, I will make an instability more stronger on the feet than putting weight on the feet itself or putting unstable, let's say, elements that we use, like pulse or things like that. So this is the way of thinking on instability. And we use it not only for the feet, also for the knees, for the pelvic, for the core, for the shoulders even. Like in static holding, moving the body, trying to hold in different lines, and it makes all the difference. It makes fast results and different results.
Great. Another question, Adam. How often do you recommend that a 12, 13-year-old gymnast who trains 24 hours a week receive a massage or visit a physio? Thank you.
1 in 2 weeks or 3 weeks.
One in 2 weeks or once in 3 weeks?
For the young gymnasts, our young gymnasts treated for 1 in 2 weeks or 3 weeks, sometimes once a month. So we have one guy that works with the young guys and he makes the massage once a month. They don't need more because we are building body. We are building feeling. So we don't need to give it a lot of releasing. They are not in the strength and the elements that need to do recovery too much.
Another question.
The body is
another question, Adam. Another question. Do you believe in taping as prevention of injuries, taping the ankles or the wrist, even if there are no injuries, like taping before?
Okay. If we need taping, then there's a problem. If there's a problem, we need to treat the main issue of the problem. Okay? If it's instability, we use the taping to stable the ankle when it's in instability. After injury, after a period of 6 months or 1 year or 2 years or 3 years of injury in the ankle, and I don't think there's one gymnast in the world that didn't experience an injury in the ankle. Twisted a little bit, even down twist. So one of the things of taping is giving the stability. If it's for the mental thinking of the gymnast, giving him, taking more risk and more freely, doing without thinking about anything, it's okay. If we use it because we know that this gymnast is in hyperlaxity problems or he has too much flexibility in the feet, it's also okay. If it's for preventing or dealing with injury, ankle sprain, let's say grade 3, 2 months, 3 months after, and we need to prevent the pain or getting into the pain, the reaction is not fully after this rehabilitation, it's okay. But just to do it as a common sense or daily use, because I saw other guys doing it, this is a mistake.
Can you recommend a lot of work on different positions? For example, the work on the side of the foot to prevent tears?
Yes, of course. We do it actually, I have to say that in the warm-up, we build like 5, 6 exercises, not more. It takes like 10 minutes from the gymnast. After he finished the warm-up, he make these exercises for the feeling, for proprioception training, 10 to 15 minutes, not more. Each training is enough to prevent ankle sprains, by the way. It's researches that we know that it's working. So there's a lot of exercises, small exercises. Let's say standing on one leg on a soft area, moving, jumping in different directions. One guy is holding the band from the upper limb, and he's jumping in different directions. After that, the other gymnast make it, and the other gymnast is holding. It gives the group also some work, some funny. And 10, 15 minutes, not more. It's enough.
Great. Hi, Adam. Thank you for your workshop on functional training. You use resistance training for recovering of power training day. You use it in different days.
Actually, in recovery, after functional training is more for some gymnasts, is more a private program, let's say, because we built it exactly for the needs of gymnasts. If I see that one gymnast, let's say, is jumping in forward and his back is weak, we have functional training for the back and all the back wall of his body. For the groups of muscles in the back legs, back shoulders. If we know that some of the gymnasts are making, most of the gymnasts, let's say we can make a full lecture about shoulders in gymnastics. Because shoulder issue, we know that 85% from the gymnasts feel the shoulder, feel some pain in the shoulder or injury in the shoulder during his career. 85%. Do you know that they make from the 85%, 15% surgeries? This is crazy. You know what? I work here with a specialist in shoulder injuries, and he said, when I show him an MRI with slab and tear of the bands or things like that, he always say me, when he quit, bring him to surgery if he will have pain. So during being a gymnast, even slab grade 3, Alex had slab grade 4 all his career. He couldn't make rings, never. But when he needed to make it, he succeeded to pass the pain. Why? Because he had a functional training in that period. So functional training, I take it out of the training. I make it like one and a half hour in the program of the gymnast. But for recovering after or recovering from training, we use different elements. We use all the apparatus of the lymph drainage suits, let's say. Some of our gymnasts have it. They have one in the gym, actually. They use it after training. It's very cheap and it's available for each one. For recovery, we make the stretching. We make small movement without weight, athlete movement, fitness movement, fast movements like running, small jumps, a lot of movements, let's say working on the horse, just making the movement in order to have recovery from all the training. So it's up to gymnast. What works with him can work with him, nothing with the other gymnasts. So we need to build the program of recovery also for each one of them.
Okay, Adam, thank you very much. Oh, one more questions from Lou. Wait, what kind of intensities do you recommend on prevention?
It can be 180 degrees because there's a lot of programs in prevention. It's up to, as I said, we need to make the examination. There is no right program without right testing. Okay, so by the way, it's very easy. The physical examination is very, very easy and it's very simple. Even coaches can make it. You don't need the physios. So I will send Ilan one of the tests that we make for gymnastics that I got from Stanford University. And you can put it in the banner. So you can use it actually. It's 7 papers, making small exercises with the gymnast. You ask him like to jump 5 times, to stand on leg, and you measure the time, things like that. Small exercises, and you give grade, but it's very clear, and you get also direction of the weakness. In the end of the exam, you have the answers. And we have the other side, the isokinetic tests, the programming tests. Now we have a lot of tests of companies that deal with physiotherapy, that they have a lot of tests like Physiomax and things like that, that gives you even a training program printed without even thinking. So it's individual. We can't speak about something that it can cover all the gymnasts.
I just would like to mention the people who asked the questions. Irene Espada was asking about the 12, 13 years boy. Lou was asking about instabilities. Manuel Campos was asking about recovering from power training day. And now you have a question from Enis Hodzic-Lederer from Slovenia. He's asking, when injury happens, is it always good to put ice on the injured place?
Oh, the old medicine. We love it. We love the ice. We have the light. Now we have another trend. The ice, the ice bath that you sit in for 15 seconds. I always have questions from athletes in different ways, even CrossFit, which is very similar to gymnastic. We take it. They ask about the ice baths. They put water and ice, and how much to stay in. 15 seconds, 30 seconds, how much times you get in, and things like that. Okay, so putting ice on the injured area by research. Finally, we have final answer. It's for the first 24 to 48 hours, not more. This putting ice is for 10 minutes to 15 minutes, not more, in the 24 to 48 hours from the injury. After that, if you put ice, you just relieve pain without relieving edema and swelling and without treating. And if you put the ice up to 15 minutes, what happens is increasing blood circulation in the injured area and increasing swelling. So if you use ice, you have to use it right and in time. In chronic pain, using ice is just for relieving the pain, because the same nerve that gives you feeling the pain feels cold and warm up. So heating or cold in chronic pain, it doesn't matter.
But for how long do you put the ice or the warmth on a chronic pain?
Chronic pain, you can put it also 30 minutes, 40 minutes. It doesn't matter. If you feel good with it, you can put it. We see gymnasts after training, put on the shoulder and working with this. It's chronic pain of the shoulder. It gives them a refreshing feeling. They can put it 30 minutes, 40 minutes, and the blood circulation is increasing with the ice. So it's kind of relieving the pain and treating the pain, chronic pain in the area, but without affecting the swelling or the injury.
Great. Okay, we have one more question. When young gymnasts have wrist pain, do you recommend using wrist braces daily in addition to strengthening our wrists and forms? Only strengthening? Thank you. Did you understand the question? Okay. Do you recommend to put the
this question? Yeah, and I understand the question. We are dealing with this question in young gymnasts. The answer is very simple. It depends on the level of the pain. If it's up grade 5, between 5 to 10, and the pain is impossible, we need to relieve a little bit the movement. Maybe not giving a braces. I like more taping and active taping, actually, which can give movement, but not the full range of movement getting into the hard pain, but living with small pain. Why? The answer is very simple. If a young gymnast feeling the wrist, it means that it's developing the direction of chronic situation of being a gymnast. Because making the movement, if you see the hands and the wrist of eldest gymnasts, you see that they are more big, and after quitting gymnastics, it gives the old shape, the right shape. So what I'm saying is that everybody needs adaptation to this sport in order to have, it's like having the skin change on the hand from using the apparatus. When the gymnast stopping, this skin will go down. And after that, it needs to be built again, starting working again. So it's the same with wrists, with elbows, with shoulders, with knees. gymnasts need to participate and feel this pain because it's kind of developing, adapting to his sport making. So this is very important for the developing. So as much as less fixation, maybe active brace or active taping can release the pain, can give him a little bit movement to keep it, and treating it fast, coming back to apparatus as much as possible. Time is not the period. I'm against long recoveries. I'm very against long recoveries because what I'm saying is losing is more than earning in this period. So we need to take the gymnast actually to gym fast as possible, doing the maximum that he can. Even the feeling of grab, if he can do it in 90 degrees, he will do it in 45 degrees. If not, he will do it in 0 degrees. But he needs this feeling all the time because with losing this feeling, will take him 10 steps back, 10 steps back to the beginning line. And in this period, we have to build it again from 0. And 90%, let's say, from the cases, get the injury back. But if we keep working right, relieving a little bit, but giving him to work all this period, he will be in the right position in the end of line.
Thank you, Adam. Any more questions from anybody? So, again and again, thank you very much.
I hope you enjoy it. I was very happy to open these banners, and we hope for more. We are waiting for these things.
We will do it.
As you see, we have a big hall. We can, after that, we can make and show a few things maybe that we do with gymnastics, especially on certain cases. You can write Ilan and the guys from EUG, and we can give a lot of ideas. We can make videos and send you. We will be happy to assist in anything.
Thank you very much, Adam. Thank you on behalf of the European Gymnastics and the Technical Committee, Mario, Nikos, Jean-Francois, James May, all the guys that are here. And so all the participants, I thank you very much for participating here. Adam, thank you very much. Have a good night, everybody. Bye-bye.
Have a good night. Thank you very much.
Thank you.
Thanks.